Today, we're going to solve a medical mystery. It's about chronic back pain, something that affects so many people. But here's the thing, we're not talking about the usual suspects.
What if that nagging, debilitating back pain, the numbness, the weakness? What if it has nothing to do with a slipped disc or your vertebrae? What if the real culprit is something else entirely? Something that's been hiding in plain sight on medical scans, but has often been completely overlooked. Let's dig in.
The condition we're talking about is called spinal epidural lipomatosis, or SEL for short. Now, that sounds complicated, but the idea is actually pretty simple. It's when too much fat tissue builds up in the space around your spinal cord. Imagine that space is a tunnel. Well, this fat is basically clogging it up, squeezing the spinal cord and nerves. And that pressure can cause everything from back pain and sciatica to weakness, and in some really rare cases, even a serious emergency called cauda equina syndrome.
So to really understand this condition, we have to rewind a bit, because for a long time, the medical world was pretty sure it knew exactly what was causing SEL. For decades, the #1 suspect on the list was long-term steroid use, corticosteroids. These are incredibly powerful anti-inflammatory drugs that are used for a ton of things. Autoimmune diseases, organ transplants, you name it.
And you know what? For a while there, the evidence looked rock solid. The very first case that was ever written up, way back in 1975, was in a kidney transplant patient who was taking steroids. Fast forward a few decades, and a big review looking at cases up to 2003 found that more than 55% were tied to taking medicinal or exogenous steroids. The connection seemed so clear, it basically became the textbook answer. Case closed, right?
Well, not quite, because in recent years, the story took a huge plot twist. As researchers started looking at more and more cases, the data, it started to tell a very different story.
The main culprit, the one that had been on the most wanted list for decades, was about to be unseated. So what on earth changed? Okay, look at this table, because this is where everything gets turned upside down. It compares that old review with a much more recent one. Just look at the numbers. Steroid use as a cause, it plummets from over 55% all the way down to 22%. And at the exact same time, look what happens to obesity. It skyrockets from less than 25% to become the leading cause by a mile. That's right, 52%. Over half of all cases of SEL are now linked to obesity. This wasn't just a little adjustment. This was a complete flip-flop. We had a new #1 suspect, and it was one that had been in the background the entire time. But wait, the story gets even more fascinating, because it turns out this isn't just about weight. The real story here is deeper. It's about a systemic issue that links what's happening in your spine to your body's entire metabolic health. To really get this, we have to talk about something called ectopic fat. It's a simple idea. It's fat that gets stored in places it really shouldn't be. You've probably heard of fatty liver disease, right? That is a perfect example of ectopic fat. Well, new research is basically saying that SEL is the same kind of thing. When your body's normal fat storage spots are full, it has to put that excess energy somewhere, and it starts depositing it in places like your organs, your muscles, and even in that narrow space around your spine. So what's driving this whole process? A condition called metabolic syndrome. And it's not just one disease. It's really a cluster of risk factors all hitting at once. We're talking extra belly fat, high blood pressure, high triglycerides, low levels of that good cholesterol, and high blood sugar. It's basically a sign that your body's entire metabolic engine is under a whole lot of strain. And this all leads us to the big aha moment. Researchers are now looking at this and saying, wait a minute, SEL isn't just some random fat deposit. One study put it perfectly, saying, SEL may be a previously unrecognized manifestation of metabolic syndrome on the spine. Think about that. The back pain isn't just a back problem. It's a sign of a much bigger body-wide issue. Okay, so armed with this new understanding, how do doctors actually figure out if you have SEL? And what do they do about it? Let's get into the final part of our investigation. What happens in the clinic? First things first, you can't spot SEL on a regular X-ray. X-rays are awesome for looking at bones, but here we're dealing with soft tissue, the fat itself. So doctors need more advanced imaging. A CT scan can show it, but the real gold standard is an MRI. It gives this incredibly clear picture of the fat and exactly how much it's squishing those nerves. And in severe cases, the MRI can show this really specific telltale clue.
Check out the image here. That overgrown fat literally squeezes the sac that holds all the spinal nerves. It's called the thecal sac, and it squishes it into a shape that looks exactly like the letter Y. Radiologists call it the Y sign, and when they see it, it's a dead giveaway for severe SEL.
So how do you treat it? Well, the approach is pretty logical. Step one is always to go after the root cause. For most people these days, that means a focus on weight loss. If steroids are the culprit, doctors will try to carefully lower the dose. But if the symptoms are really bad or they just aren't getting better, that's when surgery becomes the next step.
And surgery itself has come a long way. We're not always talking about some massive operation anymore. Surgeons can now use these amazing minimally invasive techniques. They can go in through tiny little incisions and physically remove that excess fat, taking the pressure right off the nerves. And the best part? That usually means less pain and a much quicker recovery. So we end on this really powerful question. Is it possible that some cases of chronic back pain aren't just a mechanical problem? What if that pain is actually a warning light on your body's dashboard? A direct message telling you that your overall metabolic health needs some attention. It's a huge shift in how we think about back pain, and it could completely change how we treat this incredibly common problem.